Let's talk first about traditional diagnostics. The most traditional diagnostics is using a stethoscope. How do physicians use a stethoscope? Physicians know how a healthy lung and a healthy heart sound like. So they check the sound of the heartbeat and the lung of their patients. If it sounds normal, then they're healthy. If the patient sounds not normal, then the patient has a certain disease, and then the physician passes the patient on to an X-ray, for example. Now, what do we have to do with it? The way how the physician looks at the patient is disease agnostic, because it could be any disease, and hypothesis free. The physician just wants to see if there's a deviation from the healthy pattern. What do we do is very similar on the metabolomic level. What we do is we capture patients' metabolomic information. It's disease agnostic and hypothesis free because we have built the baseline for health. We know how healthy looks like over age. We know how healthy looks like between men and women from age 18 to 70 plus. That's why we can tell. If you look at a blood sample from a patient, we can tell if the patient is healthy or is not healthy. Now, if the patient's profile is deviating from the healthy baseline, then it means that the patient has a health condition. We have in our database, hundreds of thousands of patient profiles, and we have covered about 700 diseases and health conditions. That means we know how disease looks like. We have disease patterns from the field of oncology, neurology, inflammatory diseases. That means we can, based on the profile of the patient, look at the similarity of the patient profile compared to the profiles, the digital twin profiles in our database. Now comes the best thing. I think precision medicine should be affordable. So what we do is, we have a highly scalable process with a simple workflow and no use of expensive chemical reagents, unlike genomics. Our cost to do this is less than a pizza. That means with this low cost, we can truly build a system which is affordable for everyone. And our objective is basically to establish this with leading health partners as a standard of health system for all patients, so that you look at all incoming patients, how they are doing, so that then we can accordingly do a health mapping of the patient.